Welcome to another episode of Coffee Walk MD. I'm Dr. Brian Kendall.
And I'm Dr. Brittany Bankhead.
And this is your cure
for boring conversation.
And we come to you today for a
Bearing gifts.
Another special episode. If you haven't checked it out already, the colonoscopy episode was a huge hit. And we wanted to bring back another special episode where Brittany and I use our skills as an emergency medicine physician and
a trauma surgeon.
Yes. To then give...
And emergency general surgeon, too.
An emergency general and a critical care surgeon. And you have me beat in all the categories. Yes. To try to give some practical medical information. This is not advice. Not at all what you should always talk to your doctor, all the things. But give you a little bit of insight into the medical world.
Yeah. My hair's a little Team USA. Or no, like Miss Teen USA.
Miss Teen. It looks great.
You know what I mean?
I love your hair.
Not Team USA.
Teen, I know.
We love a Team USA.
I love a Team USA.
God, so good.
Olympics. When this episode airs, the Olympics will be in
Stay
full
tuned
steam.
For the next real Coffee Walk MD. So this is just a special episode. Mm-hmm. We do these to help give you a little bit of insight into something special.
Yes.
Obvi. So be sure to subscribe and stick around for our other episodes as well. That's right.
What are we drinking this morning? What are you drinking?
All right. My mug and your mug is like one of my faves. Mm-hmm. These are basically glass beakers that then have a glass handle on them. They've got if you're here on YouTube, they've got the caffeine molecule on one side and they've got like measuring in milliliters on the other side. I just love it so much. I love when coffee and science combine.
I know you do.
And this mug is all of that.
Well, and this episode is all about coffee and science. So I thought this would be a perfect mug for that.
It is?
Yeah, sure.
No, it's not.
Well, we're drinking coffee and we're talking science. Talking medicine, which is science. Yeah, it is.
You're kind of...
And I really like it.
Can I be honest?
Yeah.
You're kind of irritating me this morning.
I know. It's been a whole morning. And the issue
I don't know why.
I know exactly why. Why? Because you are hangry. You haven't eaten this morning yet.
Yeah. I did take some coffee.
I know, but I was going to make you some.
But do you know the problem?
What?
I pounded some Junior Mints last night.
Oh, yeah.
And so now I feel guilty.
In the freezer Junior Mints?
Yeah. And so now I feel guilty this morning eating at all.
Yeah, that is
true.
But
my body's like, need nutrition, please.
Yep.
That's the problem. Classic problem.
The beans we're drinking this morning, we went back to counterculture. It's been a favorite of ours. Fast Forward is the flavor profile of this one. So if you're looking...
Look at you using words like profile.
Yeah, it is. A flavor profile. Well, they say it right here on the bag. Tasting notes. All right. Nutty, sweet, and creamy.
They want us to get into it.
Okay, let's get into it. All right, so what are we talking about today? What are we going to discuss? What are we going to let the people in on?
All right, so here's a mini plug. If you're not on Substack yet, it's actually a really cool growing platform. Lots of cool people on there, lots of cool things, lots of good discussions happening, and really a lot of good insight. Kind of like blogs, but in a news sort of way. Mm-hmm. Brian has a Substack, which he has really devoted a lot of his time and energy and efforts into. And a lot of those Substacks really reflect the conversations that he has had over the years with his own family and friends. People who are friends and family with him get the luxury of texting him and calling him, which they do very frequently, to get his insight. And he genuinely loves being able to help. He feels like that is like an area where he can help. So he has really devoted his Substack to doing this and also some of his social media. But Substack is where he really feels like he can expand and get all of that information out. Mm-hmm. And so this episode is meant to kind of be a parallel and a reflection. You like that segue?
Oh, yeah. I love that.
A parallel and a reflection of one of his recent Substack articles about urgent care and emergency care. Mm-hmm. Because here's the reality of it all. As a mom, and to be honest, I don't know a lot of what we're talking about today. I actually don't know. I might dabble in knowing, but I actually don't know much. So he is going to tell us about, hey, do I go to the emergency room or do I go to the urgent care? What about the freestanding ER that I see that's advertised on the corner of 47th and 31st? I just made that
Yeah,
up.
I know.
You were smiling.
I'm smiling. I was like, does that street exist in America?
No, it doesn't exist.
Yeah.
But the point is, when something's happening, you don't know where to go.
You don't know where to go.
And you do what you think is best, but sometimes that sucks. And sometimes you get slapped with a massive bill because you just have to go to somewhere else to get the thing done. And here, I know I'm talking a lot, but we're going to set you up for explaining all this here in a second. Here is a perfect example. We were skiing recently as a family. There was an injury that happened, and you were like, okay, we need to do this, this, and this to figure out where to go. We called the place. The place ended up not having the capabilities that we needed, but they were the closest one. I would have definitely gone to that place. We would have sat in the waiting room for hours. We would have seen the medical provider. We would have been slapped with a huge bill, and we still would have had to go somewhere else. And this is me as a very fully functioning double board certified doctor. Mm-hmm. So Brian's going to provide us with this insight so that you can avoid an extra hospital bill, wasted time, frustration, and all of those things.
Yeah. I take a lot of pride in that, like with our friends and family, over time, I have saved them hundreds of thousands of dollars and hundreds of hours from the advice that I have given them, and they've gotten the care they needed immediately.
Yeah.
All right.
Okay.
So the way we're set this up is we're going to do a few case scenarios. Each scenario is meant to highlight a different aspect of things that you should be thinking about when you need what you think is like emergency care. This is meant for not only parents and just regular people, but it's also kind of aimed towards regular people. Well, like all people, all people. And it also, though, I think can be useful for people who are in primary care and have patients that are calling their offices and trying to make sure that they're sending them to the right place. So I think it is very useful for all people.
All right. You ready?
I'm ready. So, hit me with the case scenarios. I was
waiting for you to say, hit me.
Hit me.
Okay.
Yeah.
What casino game is that? Is that blackjack?
Okay, do you want multiple choice?
Oh, no. That means it's not blackjack.
No, it is blackjack.
Oh, it is? Okay.
It is, yeah.
Phew.
Yeah.
This is
you
what
like
we
a
do.
good multiple choice.
I love a good multiple choice.
Yeah.
Okay.
All right.
I digress. All right. Case one. I'm feeling proud that I knew that.
You're very good.
Almost.
Yeah.
Okay. Case number one. I have an 8-year-old little girl named Tinsley. She's very cute.
Oh, yeah.
She's got abdominal pain. She wakes up at 2 a.m. and says, Mom, my tummy hurts. And I'm like, you're fine. Go back to bed. And then she wakes up again. She's like, no, Mom, it really hurts. This is different. And I've got that mom vibe of like, something's off, but I don't really know. Everybody has work and school tomorrow. She doesn't have a fever. Maybe she feels a little warm. I'm not sure. She hasn't puked. She's saying she feels like she needs to throw up, but she hasn't. Where do I go? Yeah.
So this is a very common mistake that I see a lot of people make.
Uh-oh.
All the time.
Okay.
Because everybody's concerned when your child wakes up in the middle of the night, or if anybody, any child wakes up in the middle of the night, your number one concern is this appendicitis? Which appendicitis, you treat appendicitis.
For sure.
Inflammation of the appendix, a unknown use organ that's just there, and surgeons like Brittany take out all the time. But the concern is it appendicitis? And so what parents will do is they go to the nearest facility. It's at 2 a.m. in the morning. Nobody wants to drive 30 minutes to get to some place. So
you pull up your phone.
Yeah, you pull up your phone. Like where?
That's what I would do.
Yeah, but Google, hospital. And when you Google hospital, lots of things are going to come up. Urgent cares are going to come up. Freestanding emergency departments are going to come up. The emergency departments are going to come up. Children's ERs are going to come up. Here is the biggest mistake that I see is that people go to places that can't appropriately diagnose appendicitis in a child. The reason being is that in order to diagnose this in a kid, you usually need to get an ultrasound. And not many facilities, especially in the middle of the night, can perform an ultrasound exam to look for appendicitis. And so this is a great opportunity to figure out, okay, who has ultrasound capability. And right now, I'll tell you, urgent cares usually do not have ultrasound capability ever, not even if it's the middle of the day. Freestanding emergency departments also usually never have ultrasound capability. Hospitals depends on the time. Most hospitals will have, like if it's an ER attached to a hospital, they'll usually have ultrasound, but even some of those places will only have ultrasound during business hours, and they won't have it at night or a certain or weekends or whatever it might be. So if you now a pediatric hospital, definitely. If you go to a hospital that specializes in children's care, they will have ultrasound capability. Should have it 24 or available 24/7, and that's usually the best place to go, but not everybody has that. So then your next best option is to pick a facility that does have an ultrasound.
Okay, so how do I do that?
So that's
it's 2 a.m. and my 14-year-old's asleep.
Yeah.
What do I do?
So what I do, and actually what I do for my friends and family, is I will call. I'll call the facility and ask them. Which facility?
Like if you've got a list of 20, in rural places you're not going to have these options. So we are talking about like you've got what you've got.
Yes, you've got what you got.
You can't change that.
Yeah.
If you've got options, there's 20 things that pop up. How am I choosing who to call first?
So you try to choose the biggest center that you can find. So I'm not choosing an urgent care. I'm not choosing a freestanding ER to call first because I know that answer is probably going to be no. I'm trying to choose a hospital. And then when I'm calling them, you don't even have to say that, you can just say, hey, listen, I'm concerned about this. Do you have the necessary medical technology? Do you have the necessary imaging to make sure that my child doesn't have appendicitis? And they'll know what you're talking about. What you don't want to end up doing is going to one of these places and then get stuck with the decision of you check in. They're not going to sit there and tell you that they don't have ultrasound. By law, they really can't. They can't. If you come to any emergency department, they let you in, and then you don't find out their capabilities until you're checked in and you're already on the hook for some sort of bill. So calling beforehand, they can then give you the actual information of, do you have ultrasound here? No, we don't have ultrasound. But if you need an ultrasound, you can go to this hospital. They have it. A lot of times they'll have that information to be able to give you.
Nice.
Yeah.
Okay. All right. Okay. Next case. We've got, let's see. I'm outside. I'm playing basketball.
Oh, yeah. We got a new basketball hoop.
Hooping it up.
Hooping it up.
If you will. Just the fact that I added if you will.
If you will.
Says a lot about me.
It does.
So I'm hooping it up with my 14-year-old, and he trips me like the son of a gun that he is.
Yeah, he's getting good, by the way.
He is getting good.
Yeah.
He trips me. Mom falls. Tries to catch herself. Crack.
Ooh.
Snap. Pop.
Yeah.
Hands are...
Yeah.
Not feeling good.
Yeah.
Arm looks broken. Okay. So what am I doing?
So broken bones. I mean, that's kind of what we're going for here.
Yeah.
FYI, a broken bone is the same as a fractured bone. There's a lot of confusion over this, and I'm not entirely sure why.
Yeah. We always get this with ribs, too.
Yeah.
Wait, is it fractured or is
it broken?
Yeah.
No. Fractured and broken, same thing.
Same.
Yeah. So fractured bone, broken bone. This is an area, actually, where a lot of times you can avoid the emergency department altogether. And I think this is a place where people don't...
I'm taking notes.
Okay. This is a place where people don't always realize that, and they end up spending a lot of money in an ER when they could have gotten away with just going to an urgent care. Now, again, I'll say, if you feel like you're having an emergency, you need to call 911. Like, this is just information. It's not advice. But most fractures, when we look at fractures... we look to see, are they open or are they closed? So when we look at your arm, and if all the skin is intact, there's no broken skin, there's no cuts, there's no scrapes or anything like that, and we can tell your arm is definitely broken, but the skin is intact, that's what we call a closed fracture. And a closed fracture is much easier to treat than an open fracture when you have the bone is sticking out of the skin or created a cut in the skin. An open fracture, 100% of the time, always needs high-level emergency care. You need a hospital that has orthopedics and all of that. A closed fracture, though, can be very easy to treat with a splint and following up with an orthopedic doctor in a day or a week or whatever it might be. So if it's a closed fracture, then you have some options. And what we have done recently for something like this is you can call around and you can look to see if an urgent care has, number one, x-ray capability, if they have the ability to take x-rays, and then asking them like, hey, I think I have a broken arm. or I think my wife has a broken arm. If we come to your urgent care, would you feel comfortable taking an x-ray and then putting her in a splint and then sending us on our way? And they'll be honest with you and tell you, yep, we can do that, or nope, we can't. And if they say no, we can't, then don't waste your time going there. Go on to the next facility.
Well, to be fair, it's usually the front desk girl, and she's
Yes.
like, hold on,
let me ask. Yes, which I appreciate.
And she pokes her head back and
Yeah.
says, hey, can we do this?
This is what we got on the
then
phone.
Answers.
Yeah. And an urgent care visit is, you get $50, $100, whatever it might be, compared to thousands of dollars in the emergency department. Same, like with kids, it can be a little dicier here. You really need to specify the age when you are calling and letting them know I've got a child that's this age or that age. Because in kids, they can't always get the same type of treatment that adults do, and they usually need like a sedation to get the splint on.
So keeping it simple though.
Yeah.
Let's bring it back.
Okay.
So I fall outside.
Yeah.
If the bone is sticking out or if there's a cut over where we know that it's broken, I need to look on my phone for a main hospital of some kind. Ideally something that has the word trauma in it, but some sort of main big hospital because I'm going to need antibiotics and more things.
Yeah.
If it's not that, then I've got some options and I can call to an urgent care that might be cheaper, might be closer, might be less of a wait and say, hey, can you do x-rays? Can you deal with broken bones? Which is that something your facility does?
Yes, exactly. And you're probably not calling because you're in pain.
Right.
But as I am getting you into the car and we're heading to that way, I've Googled these numbers and I'm calling them and asking.
Okay.
Yep.
All right. Case number 3. A cut. A laceration, if you will.
Yes.
So this time, our daughter is cooking in the kitchen, and she has a knife. She's like her mom. She loves a knife. And she takes...
For medical purposes only.
Yeah.
And cooking purposes.
No. Yeah,
yes.
I'm a surgeon.
Yeah.
I love a good knife.
Our daughter is not Michael
knife.
Myers.
No.
Yeah.
So she takes that knife and
Yeah.
she accidentally cuts her brother.
Ooh.
Whoops, he was going in to get something and now he's got a slice across his finger.
Yeah.
Classic problem.
Classic.
So blood's gushing. I'm super scared. I'm freaking out. We're not going to talk about the medical care of that cut. We can do that for another day. Or you can ask us questions. We're always happy to answer. But in terms of like, okay, now the bleeding's kind of less. Okay, now where do we go?
Yeah. So the number one question that everybody is on everybody's mind is, does it need stitches? If like, let's say it's not bleeding all that bad and it's just like a little cut and it's like, oh, does it need stitches? Does it not? Here's newsflash. Your body is amazing at healing itself.
Yeah, it is.
Yeah.
Unless, again, caveat, immunosuppression, chemotherapy, like all these things. We can't help ourselves but to mention that.
Yeah.
But like in general, a healthy adult or kiddo, you're really good at healing.
So a lot of people come in thinking they need stitches because without stitches, it won't heal. That is not true. Nope. Your body will heal it just fine. The reasons for stitches are two big ones. One is to control bleeding. Stitches help apply more pressure, help stop bleeding, and so we will use it for that. The second one is for cosmesis. When you do stitches the right way, it brings the skin together in such a way that when it reforms, when it does heal, the scar will be smaller. So it won't be as glaring of a abnormality in your skin. So those are the reasons for stitches. It's not necessarily that your wound won't heal. So if the wound is bleeding a lot, if the wound, when you look at the wound edges, if they're on the camera, I'm kind of showing it, but like if the wound edges are far apart from each other, gaping, and not like just close together and touching, then stitches. If it's gaping, probably going to need stitches. If it's really deep, when you're looking at this thing and you're like,
I can't see the bottom of it.
I can't see the bottom of it. Or like, is that muscle or is that bone? Like if you're asking yourself that question, probably going to need stitches as well.
What about dirty wounds?
Yeah, dirt. If it's got a lot of dirt in it, if then yes, probably
Cut it on a rusty nail outside. Yeah,
exactly. And sometimes in those wounds, we don't put stitches in them, or we only loosely.
I meant in terms of where you're going to go.
Where you're going to go, yeah. So then it's like, okay, we've decided, okay, it does need stitches, and it's always good to go in and get it checked no matter what. If you have any question at all, it's always good to get it checked. But most places, urgent cares are great at this. Mm-hmm. You don't necessarily need an emergency department to put stitches in. Most urgent cares can do this, no problem, save you a lot of money. Even freestanding ERs in this case, usually a really good place to go if you're wanting to go to like an emergency department. ERs themselves, probably not always the best place to go because they're going to be a very busy place. A lot of the cuts get put, especially the minor ones, get put way back in the queue because they're triaged as a very low level. So you're going to end up waiting a much longer time. Mm-hmm. But again, if it's bleeding a lot or anything like that, then the more concerning that cut looks to you, if you're looking at it and you're kind of freaking out, like, wow, that's a big cut. I think about our son when he got hit by a bat on his head and it was bleeding a lot and all that. Those are instances like, okay, probably the emergency department. But if it's just a little cut with a knife or something of that nature, then a lot of times you can get away with urgent care or a freestanding ER.
Yeah, and also like my 2 cents here, you're clearly the expert on it, but as a mom, if we have any say at all in taking our kids to somewhere that handles pediatric patients specifically, it makes a very big difference in the quality, not necessarily the quality of the fixing, but the quality of the like peri-procedural things.
Yes.
So like how the nurses and the doctors are interacting with the kids, being very nervous versus like very comforting. The lidocaine that they've got, the patches they've got, the just kid-friendly things and dosages of things to make things better. Like people who are used to doing IVs and shots for kids versus those for adults. Like it's just a different world. And so if you have to go somewhere, my mama heart says go somewhere with pediatric capabilities. It will always be a better experience 100% of the time.
Yeah. Especially in the kids. The thing that breaks my heart is when kids that have medical, like even like infants and stuff who have had, medical experiences early in their life. Maybe they stayed in the NICU, they were born preterm, they get all of their care at like a pediatric hospital. Mm-hmm. And then they go home and then there's something else that happens and then their parents bring them in to like a freestanding emergency department or to an urgent care. That is, can they maybe stabilize? Yes. But in those instances, it's always like the pediatric hospital personally for like our kids, like that's where we go. Like we are always going to take our children to a place that has pediatric specialized care in case they need it.
Yeah.
Yeah.
All right. Last case. So my parents have a place on a lake. It's kind of remote, like most lake places are. And we're out there. There's a big group. And all of a sudden, my uncle starts to feel like I'm kind of warm. Like I know it's warm outside, but I'm feeling warm. I'm feeling like I'm kind of dizzy and I don't have chest pain, but I feel like I've got some pressure in my chest. Almost like an elephant is sitting on me. What now?
Yeah. So this is a great case to highlight that there is nothing wrong with calling 911. Mm-hmm. And
again, pause.
Yeah.
This is not medical advice.
No.
It is information.
Yes.
Because we want good information disseminated.
Yeah.
We want truthful information disseminated from people who know what's going on.
Because there's truly not enough education and information about this kind of stuff out there.
Okay.
Because I have definitely taken care of people who are having heart attacks that were like afraid to call 911.
Right.
Because they were like, oh, I don't want to waste their time, or I don't know what's going to happen if I call 911, or I don't like. No. If you're concerned about having things like a heart attack, or you think you're having a stroke,
or anything,
or any emergency, 911 is the best thing
That's
to
why
do.
they exist.
That's why they exist for one huge reason, multiple reasons, but the biggest reason is that those paramedics and EMTs are highly trained to not only save your life, but also to get you to the hospital that's going to get you the care that you actually need.
Yep.
Because how many
People
times...
forget about that.
Yes. Yeah. How many times the primary care doctors and the providers and urgent cares can attest to this. How many times have you had somebody show up to your clinic who is having chest pain and having a heart attack, and then it takes an hour or 2 hours to get them to the definitive care that they need? Whereas if they would have just called 911 and gotten into an ambulance, they could have had their heart opened up, the blood vessels opened up within 30, 45 minutes, avoided heart damage, avoided all sorts of bad things. So 911 definitely has a purpose and a point, and one of the biggest ones is to get you to the care that you need. Because if you go to those places and you're thinking or you drive yourself or whatever, and you go to the wrong place and you check in, well, here's what's going to happen. You check in, they're going to look at you, and they're going to say, we don't take care of that here. Now you got to go somewhere else. And now you're either waiting for an ambulance or you're trying to decide if you want to drive yourself. Tick, 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 tick. That clock is ticking. And time is heart and time is brain. And every second that goes by, you are potentially losing heart muscle, you're losing brain tissue, and your symptoms and your outcome is going to be worse.
You're very passionate about this.
I am very passionate about this because I have been in this scenario where somebody shows up to a freestanding ER and they're having a massive heart attack, and now we are scrambling.
Yeah.
But no matter what I do, it's going to take at least 30 minutes to get an ambulance to you and get you on your way. And then you're talking about the transport time, and people need to know that it is okay to call 911.
Okay, so back to the scenario.
Yeah.
Okay, so feeling hot, feeling like there's something on my chest. I've never felt that before. I'm very uncomfortable. I'm out at a lake.
Yeah.
And what now?
Now I'm calling 911. I am. I'm going to tell your family member, listen, it may be nothing. This may be absolutely nothing, but with the symptoms that you're experiencing, it makes me concerned about a heart attack. It should make anybody concerned about a heart attack. And we're out in the middle of nowhere. And so the best way to get you to a place where you need to be is going to be by ambulance.
Okay, so why can't, because here I can hear it now.
Yeah.
But the nearest small hospital is like 30 minutes away, and I feel like if I just haul butt over there, I can get him there quicker than waiting for an ambulance to come and going. So why am I not waiting? Why can I not just take him?
Because 911 may choose to send a helicopter. They may sit there and say, you know what, this sounds really serious. We're going to send Life Flight out there to, or whatever, that's what I call it. I'm not trying to endorse any brands here, but we're going to send a helicopter out there and they're going to fly him to the nearest cardiac facility, the nearest ER that has a catheterization lab that can treat him appropriately, as opposed to you driving an hour to the rural hospital and then being told, yeah, you're having a heart attack, but there's nothing we can do about it.
Yeah.
And now we got to fly you or drive you to the next hospital over.
Or if they don't send a helicopter, maybe you put your uncle in the passenger seat and you start driving and all of a sudden he passes out.
Yeah, or goes into cardiac arrest.
What are you going to do now?
What are you going to do now? That's
with
right.
You and that person.
Now you're stuck on the side of the road.
Now you are absolutely stuck.
Yeah.
You have no one, that's really bad. So, and you can't tell EMS where you are. That's the other big reason to not do it.
Yeah. So recapping all of this, there's urgent cares, there's freestanding emergency departments, there are ERs with some capabilities but not total capabilities. There are ERs that have all the capabilities. It's really good to prepare yourself prior to any of this. Just do a quick Google search around your area and see what is out there.
And if you're going to be traveling, especially for an extended amount of time, or if you have someone in your group who has medical things, just familiarize yourself with what's around.
Yeah. And then continue to educate yourself. This is why I do what I do on TikTok and Instagram and on Substack. I want the education to get out there. Again, it's not advice, but it is just so you have some information so you can be empowered in these moments where you're not setting yourself up for financial ruin going to a place, or even worse, healthcare, like your health deteriorating because you choose to go to the wrong place.
Or being worried that your symptoms aren't enough for you to go to a big ER and that you're going to make people whatever. No, that's why we're there, and we want to help.
Yeah.
And we'd always rather you come in than not.
For sure. Well, that was a fun special episode.
All right. Special episode. Check. Again, thank you so much for joining us on this very special episode of Coffee Walk MD. Next time we're going to be back to another regular episode, so be sure to hit subscribe both on your podcast or on YouTube. You usually do this part, so I do.
I'm letting you roll with it. You're doing good.
It's like, here's the other thing. If you have any questions that you want us to answer, we are totally open to that. We answer them all the time, both on social media and here on the podcast. We would love to do that, either for future Coffee Walk episodes or for these special episodes.
Yeah.
All right.
Well, thanks again for joining us on Coffee Walk MD, your cure
for boring conversation.